Cruz, and I want to give a special thanks to Alicia Enriquez, who was my mentor over these 6 weeks in Child Protective Services. I truly loved the experience. Thank you for sharing amazing cases to help me understand forensic interviews, psychosocial screenings, medical neglect, physical and emotional abuse, and lastly, shadowing the child abuse pediatrician. I also want to give a special thanks to Kay Maderos for being a wonderful mentor. Kay guided me with her clinical expertise in OBGYN. Thank you for shadowing. Thank you for helping me shadow the importance of research planning and screening new OBs. And a special thanks to Rosa as well for letting me understand what are BTL forms and also sharing her clinical expertise with different cases. Thank you for every single person who made this possible.
Hi, my name is Ashley Goldsberry, and I want to thank both my mentors for this experience that they've been able to give me through the NERA Behavioral Health Program. If it wasn't for them, I wouldn't have gotten all this extensive knowledge on two fields that I couldn't even begin to understand when I first got assigned to them. Inpatient medicine/surgery and care management wasn't what I was expecting when I came into this, and I'm walking out of it knowing so much thanks to both of you. For Sam, you taught me the importance of being able to advocate for your client. Sometimes your voice isn't always heard, and that's our job as social workers, to come there and make sure that their demands are met. You also taught me that sometimes you have to redirect the conversation, even if it's a little bit uncomfortable. You also taught me how important self-care is. Being able to walk back in that room, especially after a hard situation, and laugh at your coworkers really is the push you need on that hard day. For Norma, you taught me what rapport building can do for a relationship. That strong relationship you could build between the client and the social worker is so important, especially when you've known them for so long, and it allows you to be able to cover so much more ground when you have that background with them. You also taught me that language doesn't have to be a barrier, that you can have a 2-year relationship with somebody who speaks Bengali and you don't. You also taught me that judgment is really important, and realizing that not every client is the same, and that some clients, because they're different, need a different approach, and our job as social workers is to adjust that. And I just want to say I'm so grateful to have both of you, and I've really enjoyed this experience.
Hello, my name is Samantha Fuentes, and I was given the opportunity to shadow Adeline and Emily in inpatient HIV and oncology through the NERA Behavioral Health Program. I learned an extensive amount of information in rounds and working directly with patients. I learned about different insurance plans and resource opportunities like HACA and ADAP that helps HIV patients with housing and care management. I also learned about NILAG, also known as the New York Legal Aid Group, that helps patients that are undocumented. Additionally, on top of all of this, I also learned about the 3 different types of leukemia in relation to the process of chemotherapy. I feel grateful and appreciative and blessed for my 2 mentors who have allowed me to shadow them and who were open to discuss and re-clarify anything that was not clear to me. This opportunity was remarkable and has reassured my aspiration of being a licensed clinical social worker and helping those in need. Thank you.
Hi, my name is Mary Azar. I've been shadowing in outpatient psychiatry for the last 5 weeks, and I just want to say thank you to Leah Bone and Melissa Eels for taking me in. Melissa, you've been more than a mentor for me to shadow, but a friend. You've let me intrude on all your writing notes and making phone calls, and you've asked all the questions I had and even answered the questions that I didn't have, like what to do when a patient is in an elevator in the fetal position crying. You've left no part of your job a mystery, and you've given me every opportunity possible. You've let me sit in on PHP and IOP, and you've let me become acquainted with every nurse practitioner, psychiatrist, social worker, mental health professional, and they've taught me so much more than I could have ever learned in a social work textbook. Just some of the things I've learned from you: where to get coffee, best places to stroll in Central Park. You've taught me that I'm not necessarily going to like all of my patients or agree with them, but that's okay. And you've taught me about self-care. You've shown me the love for your patients and your work. Finally, you've taught me that all of us are working on ourselves and that we shouldn't be discouraged, but we should use that to inform our practice. Leah, I just want to begin by saying that you are very busy, and I want to thank you for taking me into your busy career. With that said, I want to thank you for being the perfect example of what a social worker should be. You've exerted grace, compassion, professionalism, and patience. You have been honest with me, you have encouraged me, and you've even encouraged me to fail a couple of times, but that helped me learn. You've taught me about supervision and biases and the importance of knowing yourself. By watching you interact with clients, you've exhibited empathy, acceptance, and unconditional positive regard. You've taught me to trust your gut feeling and when to accept that you cannot help any longer. And most of all, you have taught me to make the best of every situation.
Hello, my name is Brian Bracero, and I was blessed to be placed with Carolyn Hudson for adult dialysis and Claudia Pompani for pediatric liver transplant. Originally, I entered this program with a limited outlook on what area of social work I wanted to focus on. The NERA Behavioral Health Program, along with Carolyn and Claudia, gave me the opportunity and exposure to the many different aspects of what it is to be a medical social worker. Carolyn and Claudia, thank you for taking me under your wings and providing me the tools, education, and support I needed to work within the behavioral health department. You both are admirable women and have truly inspired me. I love you both. Thank you.
Good afternoon, my name is Janice Solano. Through the NERA Behavioral Health Program, I was able to shadow Madi in the NICU and Dana in pediatric endocrinology. Through the program, I was challenged emotionally and physically. I was pushed out of my comfort zone to learn more about this field. Thank you, Madi and Dana, for allowing me to learn and experience hands-on patient care. I learned that meeting the patient where they are at is essential, providing the patients with the best care necessary. I also learned that medicine is just played as a team sport. Through team rounds where social workers, nurses, physicians, PAs, chaplains, and any other medical staff make decisions for the patient. Being able to be part of the team reassured me that clinical social work is a career path that I want to take. Social workers are superheroes. We meet patients in their time of need and support them through stressful situations. Thank you again, Mani and Dana, for this experience. I am extremely grateful.